Now, the state of Karnataka is under complete lockdown today in line with the recent state government's decision to have full lockdown on Sundays, particularly to try and break the chain of COVID-19 cases. The Sunday lockdown started from 8 p.m. yesterday and will continue till Monday morning 5 a.m. Only essential services will be allowed to function. Movement of people for regular work will not be allowed. This comes as a state, even as it sees a single biggest spike in a day. 1,839 new cases of COVID-19 reported on Saturday alone. Out of these, 1,172 new cases have surfaced from Bengaluru itself. The state also recorded 42 fresh deaths as per the Health Ministry website. The state has now 21,549 cases and 335 deaths. Let's quickly cut across to Nolan Pinto joining us live from Bengaluru. Nolan, take us through the severity of cases in Karnataka. From a mere 6,000 odd, we're looking at a jump. 21,549 cases reported on the whole. Take us through the active number of cases that have been reported as of now, of course, including the death toll across the state.
Well, good morning, Nabila. In fact, if you're actually looking into the number of cases from June, there has been, for the month of June, there's been a 1,083% increase in the number of cases, especially in Bengaluru. Bengaluru had hardly less than, say, about 400 odd cases starting of June. That's when Unlock 1.0 started or began. And towards the end of June, after the 26, 27 is when the spike or the surge took place. So as of now, we have a large number of cases right over here. Yesterday, we had 42 deaths across the state, 24 from Bengaluru itself. That is another major issue and worry for the government because the fatalities, especially in Bengaluru, is quite high when compared to the other districts. We have 30 districts in Karnataka. Now, because of this, certain steps have been taken. Like you rightly stated, Sunday is a lockdown. What the government believes is that the experts tell them that we need to have this lockdown in order to break the chain. The Chief Minister also wanted Saturday and Sunday to be a lockdown, but because of the experts and the ministers, they stated that let's, for the time being, have only Sundays. Now, apart from essential services, everything else is shut in the city. Now, experts also believe that ever since, the government actually allowed people to come out, people started not following the rules, if one could actually call this, and this is one of the reasons for the spike that we're seeing in places like Bengaluru, in Mysuru, in Mangaluru. These are the three places or three districts that have seen a large number of cases. Two, the second reason is there's a huge backlog of cases. Yesterday itself, the chief of the Karnataka COVID war room stated that there are some 36,000 samples that are still to be tested. Basically, we are still waiting for those results. So that is another issue, a backlog. But mostly it's this, as of now, whatever the government says, a large number of private hospitals have been roped in, but the fact on the ground is very different. People have actually gone to emergency rooms only to be stated that there are no beds available. And when they actually ask them to go to another hospital, the response that they normally get is that they've already gone to 8-9 hospitals and everyone says there are no hospital beds. And that's one of the reasons that the government has now come out with a number, a helpline number where people actually can call them and they will look into which hospital has particular beds. They can also call 108. The ambulance will actually come to their homes, their residences with paramedics. They will actually figure out whether these people need to go to a hospital or be shifted to a COVID care center. So all
these efforts by the government, does it actually play out on ground? We're looking at a huge outcry. People, they're saying that there are no hospital beds. When they try to reach out, they're not able to reach out to hospitals because there's no response. Nobody answers phones. There are people who are serious, who need to be rushed to various dedicated COVID hospital, but they have to run pillar to post before they actually land at a designated one where doctors there itself are, the administration there itself are a little hesitant to take just anybody until they get a test done and until they have a report in their hand. How is that even possible?
Very true. So these are policy decisions. So on paper, it looks really good. But when it comes to implementation, it's not working on the ground, Nabila. That is the problem over here. So while the ministers, right from the chief minister to the medical education minister, health minister, deputy chief minister, all say that we are looking into these. We have come out with new policies. Hospitals should not deny, should not refuse, or they will take action against them. But on the ground, things are not working that way, and that is the reason people are suffering. There are no hospital
Absolutely.
beds, ambulance don't come when they call them, and people themselves on the streets do not follow the rules. Nabila, one important point, after 8 p.m. to 5 a.m. is supposed to be curfew, but get out in the streets. Even at 10 o'clock, you'll have people roaming on the road.
That's
So
exactly
either the government does
the
not
lack
know,
of
or the officials do not know.
responsibility. Absolutely, Nolan. There's that much that the government can do. On the other hand, it's the people, it's the society that needs to show some responsibility on ground as well. We've got to see both hands coming together in an effort to fight this pandemic. Nolan, thank you very much for joining us with those details.